Good afternoon, everyone. I am Khaled Shkair, the lead for Stroke Center certification with the American Heart Association. I'm going to give you today a high-level overview about the stroke certification journey. Let's start by discussing how we can strengthen the stroke care delivery. Transforming stroke care requires focused effort in connecting all the components of acute stroke care into a smoothly integrated system that reinforces the use of evidence-based guidelines, measures performance, identifies gaps, and engages in improvement projects at a system level. Definitely, that starts with community awareness to identify stroke, early EMS activation, and continues through the hospital treatment to discharge, in addition to rehabilitation and initiation of secondary prevention. This brings together hospital, EMS, regulatory bodies, insurance companies, and all to shape the proactive stroke system of care that saves and improves more lives. So in this slide, we can see the impact of our work, and I'll be highlighting the key milestone in the stroke care journey. As you can see, American Stroke Association was formed in 1998, and in 2003, we launched the Get to the Guidelines Stroke, and 90 hospitals participated in that registry at that time. Today, we have more than 2,200 hospitals caring for more than 80% of all ischemic stroke patients participate in the program. In 2010, stroke program was launched to support hospitals in reducing the time it takes them to treat ischemic stroke patient with IVTBA. In 2013, American Stroke Association launched its Together to End Stroke initiative to raise awareness that stroke is preventable, treatable, and beatable. We also launched our first campaign with the AD Council using the FAST acronym to increase public awareness and knowledge of stroke warning sign and the importance of calling the emergency number as early as possible. In 2015, American Heart Association, American Stroke Association released the focused guidelines recommending the use of mechanical thrombectomy for the treatment of patients with large vessel ischemic stroke. So as you can see in the slide here, the different options of certification in the United States, we offer 4 levels of certification, starting with acute stroke ready hospital certification and ending with comprehensive stroke center. And we brought to the MENA region 2 levels, the primary stroke center and comprehensive stroke center. As of September 2021, there are 1,971 American Stroke Association certified stroke centers. Majority definitely will be like the primary with more than 1,500 and around 227 comprehensive stroke centers. Now let's talk a little bit about the MENA and specifically here in this press release about the UAE. According to this article, which was published in October 2019, every 30 minutes, a stroke patient is either disabled or suffer from a stroke in the UAE, which emphasizes the importance and the need for the implementation of stroke prevention and treatment processes so that lives for stroke patient can be saved and permanent disability can be reduced. And as per Dr. Suhail Rokon, the president of MENA Stroke Organization, who said in this article that having such certified centers will decrease the mortality rate, the complication, and most importantly, improve the outcome of stroke. Therefore, early in 2020, American Heart Association and American Stroke Association and MENA Stroke Organization, called MENASO, have entered into a collaboration to work together to advance access and treatment for stroke patients by certifying the hospitals that really can demonstrate compliance by meeting the international standards of care for stroke patients. Both organizations share the belief that healthcare facility certification has a great potential to improve the assessment, diagnosis, and treatment of stroke patients. So in this slide, we can see the different ways that the patient might reach one of these certified centers. Either the patient will go to the center itself, primary or comprehensive, or being transported by the ambulance or the EMS services, or being transferred from another facility. The most important thing is to reach to the appropriate facility on time to give the appropriate management and treatment. So now let's spend a few minutes talking about the eligibility criteria. The American Heart Association, American Stroke Association, and MENA have developed an eligibility checklist for the hospital who are looking to pursue certification, either primary or comprehensive stroke center. So first, having an appropriate infrastructure in place is key in establishing a stroke center. The infrastructure should include an identified stroke unit, identification of appropriate staff, participating in stroke registry, as well as a professional training and education for the entire stroke team. If we talk about the staffing requirement, the hospital must have an identified stroke director, a 24/7 acute stroke team, an interdisciplinary team, as well as option for stroke rehabilitation to ensure that the patient have the most optimal outcome post-hospital discharge. Moreover, a comprehensive stroke center definitely has additional staffing requirement to ensure that there are specialized and trained neurospecialists available 24/7. Furthermore, to be eligible for certification, stroke centers also must meet a minimum volume requirement. However, if the center are not able to meet this requirement, there must be a demonstration of quality or performance improvement activity that measures overall outcome for stroke patient that facility treated. Finally, stroke centers are also required to be able to perform diagnostic technique through specialized imaging, surgical intervention, and 24/7 access to CT and laboratory. In addition to meeting the eligibility criteria, which I have mentioned, hospitals seeking stroke center certification are also required to submit KPIs regularly to the American Heart Association, American Stroke Association. Performance measures provide an indication of the organization's performance to specific measures in relation to outcome. We have listed here in this slide an example of the minimum requirement for the primary stroke center that need to be submitted in a quarterly basis. So here we can see 8 KPIs, starting with the VTA prophylaxis and discharge on statin medication, stroke education, access for rehabilitation, and so on. So this is the minimum KPIs for the primary stroke center. In this slide, we'll be talking about the stroke center certification process. The stroke certification process is very transparent, straightforward, and is based on a data-driven model. Once the facility show interest in this program, the process starts by signing the agreement and submission of the documents. The American Heart Association, American Stroke Association, and MENA strongly believe that data drive quality, and through ongoing data collection, evaluation, and quality improvement activity, our review is established to help hospital achieve and maintain certification status over time. So from where we are going to get these data, from one of these 3 global stroke registry. The first one is Get With The Guidelines Stroke, or if the hospital are participating in rescue or SETS, these both data registry are acceptable as well. To move to the next step, which is the review, which start with the disc review and then virtual review. The disc review to measure compliance to the program standards through data review, interviews, and identification of the best practices, as well as the areas for improvement. Then followed by the virtual review, which is a meeting that is scheduled after the disc review and include formal presentation by the acute stroke team, followed by the virtual tour in the facility with staff interviews and discussion by the reviewer team. This effort is to support definitely the hospital in their journey to achieve stroke certification status and improve stroke care together globally. Participating facility definitely will have access to a variety of professional tools and educational resources for both healthcare provider as well as patient and caregiver. To conclude, the stroke center care paradigm ensures that patient will receive the proper level of care in each case. Both primary and comprehensive stroke center are essential component of a stroke system of care, which will promote a flexible system that can adapt and fit a variety of regional and geographic scenarios. And lastly, improved outcome definitely will reduce the financial burden on government and healthcare systems. Thank you very much, and we'll be waiting for your questions in the Q&A session. Thank you.